Metabolic syndrome is a cluster of conditions including high blood pressure, elevated blood sugar, excess abdominal fat, abnormal cholesterol levels that together increase the risk of heart disease, stroke, type 2 diabetes. Its rising prevalence worldwide has made it a critical focus of medical research scientists seek to understand. Its mechanisms, risk factors, potential interventions. Recent studies provide valuable insights into metabolic syndrome, exploring its relationship with chronic inflammation and gut health, examining the protective effects of omega-3 fatty acids, and investigating the role of dietary fructose. Together, these studies paint a multifaceted picture of metabolic syndrome. They highlight the interplay of inflammation, diet, metabolism. A study published in the International Journal of Molecular Sciences in 2022 delves into the connection between metabolic syndrome, chronic inflammation, and gut microbiota. It argues that metabolic syndrome is not just a metabolic disorder, it is also an inflammatory condition driven by disruptions in the gut. The researchers emphasize that the gut microbiota, trillions of microorganisms living in our intestines, play a pivotal role in regulating metabolism, immune responses. In individuals with metabolic syndrome, an imbalance in these microbial communities, known as dysbiosis, triggers low-grade systemic inflammation. This inflammation, in turn, worsens insulin resistance, a hallmark of metabolic syndrome. The study highlights how factors like obesity, poor diet can alter gut permeability. This allows bacterial components like lipopolysaccharides to leak into the bloodstream, fuel an inflammatory cascade. What stands out here is the idea that metabolic syndrome might be tackled not just through traditional metabolic interventions, targeting the gut, perhaps through probiotics. Dietary changes that restore microbial balance could also be effective. Shifting focus to dietary interventions, a study in Nutrients from 2020 investigates the effects of omega-3 polyunsaturated fatty acids PUFAs on metabolic syndrome. Omega-3s found in fatty fish like salmon, in supplements like fish oil, are known for their anti-inflammatory properties. This study conducted a meta-analysis of randomized controlled trials to assess whether omega-3 supplementation could improve metabolic syndrome components. Triglycerides, HDL cholesterol, waist circumference were among them. The findings are promising but nuanced. Omega-3s significantly reduced triglyceride levels, a key metabolic syndrome criterion, showed modest improvements in HDL cholesterol blood pressure. However, effects on waist circumference, fasting glucose were less consistent. The researchers suggest that omega-3s work partly by dampening inflammation, improving lipid metabolism. The benefits depend on dosage, duration, baseline health status. This study underscores the potential of omega-3s as an adjunct therapy for metabolic syndrome. It is not a silver bullet. Lifestyle changes remain essential, including diet and exercise. A study from Nutrients in 2019 takes a different angle. It examines the role of dietary fructose in metabolic syndrome. Fructose, a sugar abundant in sweetened beverages, processed foods, has long been implicated in metabolic disorders. This review synthesizes evidence linking excessive fructose intake to metabolic syndrome, particularly through its effects on the liver. Unlike glucose, fructose is metabolized almost entirely in the liver. It can overwhelm metabolic pathways. This leads to fat accumulation, insulin resistance, increased triglyceride production. The study highlights how fructose-driven liver stress contributes to visceral fat buildup, systemic inflammation. Both are key drivers of metabolic syndrome. Interestingly, it also notes that not all fructose is equal. Naturally occurring fructose in whole fruits, paired with fiber, antioxidants, poses less risk than the concentrated doses in sugary drinks. This distinction suggests that curbing processed fructose could be a practical strategy for managing metabolic syndrome. Together, these studies reveal that metabolic syndrome is a complex condition. It is shaped by inflammation, gut health, and dietary choices. The inflammation angle ties them all together. The International Journal of Molecular Sciences study shows how dysbiosis sparks chronic inflammation. The Nutrients omega-3 research demonstrates a way to counteract it. The fructose review traces how diet can amplify it. This convergence on inflammation as a central mechanism is striking. It's not just about calories or cholesterol. It is about how the body's immune system interacts with its metabolic machinery. The gut emerges as a surprising player, acting as both a victim of poor diet and a perpetrator of systemic harm. Meanwhile, diet, whether through omega-3s or fructose, offers both risk and remedy, depending on how it is wielded. What does this mean for tackling metabolic syndrome? The research points to a multi-pronged approach. Restoring gut health could involve probiotics, prebiotics, and the gut-focused study cautions that we're still unraveling which microbial profiles matter most. Omega-3 supplementation, as the Nutrients 2020 study suggests, could help especially for those with high triglycerides. It's no substitute for broader dietary reform. Cutting back on processed fructose, per the 2019 Nutrient study, seems like a no-brainer. Swapping soda for water could lighten the liver's load. Yet these interventions are not one-size-fits-all. Genetic factors, lifestyle habits, socioeconomic barriers to healthy eating complicate the picture. The studies also raise questions for future exploration. How do omega-3s interact with gut microbiota? Could they work synergistically to reduce inflammation? Does fructose exacerbate gut dysbiosis, creating a vicious cycle with metabolic syndrome? How do we translate these findings into practical, scalable solutions? For now, the takeaway is clear. Metabolic syndrome is more than a metabolic checklist. It's a dynamic condition rooted in inflammation, influenced by what we eat, how our bodies process it. Addressing it will require not just pills, but a deeper understanding of the gut metabolism-immune axis. In conclusion, these studies offer a compelling snapshot of metabolic syndrome research. They highlight the promise of targeting inflammation, the gut, the benefits, limits of omega-3s, the perils of fructose overload. For individuals, this might mean more fish, fewer sugary drinks, perhaps a probiotic boost. For science, it is a call to keep probing the connections between diet, microbes, and metabolism. As metabolic syndrome continues to burden global health, such insights bring us closer to turning the tide. Thank you for watching. Be sure to hit the like and subscribe button and stay tuned for more content.